It is fall out here. Today is the last day of October. For many, that's Halloween. I don't have my costume on yet. But we've been talking about breast health all month of October. And on this last day, I want to answer a really important question that I hear all the time is, are hormones safe for breast health, particularly in somebody who has had a history of breast cancer or a family history of breast cancer, or just in general? In my opinion, I think we should treat everyone the same from that perspective. So I would treat somebody who has a history of breast cancer the same as somebody who hasn't had a history of breast cancer yet, because I don't know if they have similar risk factors or, what's going on. So everybody needs to be on the same boat in terms of how to protect our breast health. And there was a big bad conversation about 20 years ago with the Women's Health Initiative about breast cancer associated with hormone replacement. However, that hormone replacement was Premarin and Prempro, which were synthetic hormones taken by mouth, and we did see a significant concern for breast cancer in those patients, especially the ones that were taking Prempro. But the concern is that that pro that was in that particular hormone replacement was not bioidentical progesterone, but a progestin, which is a synthetic, and it caused all kinds of problems, especially when it went through your liver. So we have so much data now that tells us that getting on bioidentical hormones, applying them topically as opposed to taking an oral or getting something like a pellet injection are very safe, and they do not, I repeat, they do not increase the risk of breast cancer. And in fact, I think that optimizing our hormone health can help us reduce inflammation and actually make us feel better so that we can do some of the other things that we know are going to help reduce our risk for breast cancer, like eating a better diet, walking and exercising, getting good sleep, all these things that are going to be supportive for overall health in general. So you're going to feel better, and you're going to not be walking around afraid of taking care of yourself and taking care of your health, not causing you to have some other, issue like cancer coming up. So hormones are safe, 100%. We see it all the time. And take care of you, take care of your breasts on this wonderful Halloween day, and holler if you have any questions or anything. If you're thinking that this is something that resonates with you, then click on the link so that you can get scheduled with a discovery call with our team and see how working with us may be able to help you feel amazing and optimize your health. Awesome.